Hey everyone, welcome to my YouTube channel that is Vlog by Dentist. As you people know that we have started the MCQ series that are in dental professional exams like NBDE and FCPS Part 1 or may help other people with the medical fields. So starting with our first MCQ, that is at the level of 6 cervical vertebra. The options are common carotid artery bifurcates, or superior laryngeal nerve divides, or esophagus begins, or recurrent laryngeal nerve divides into internal and external branches. For this MCQ to correctly answer, we need to understand what all these four things happen and where these happen. So starting with the first one, common carotid artery bifurcates at the level of C4. Here you can see in the diagram, this is common carotid artery and this is its bifurcation, and here you can see the vertebra that is C4. So we can say that common carotid artery bifurcates at C4. So the first option for this MCQ is not correct because it is at C4, not C6 level. Now we will look at the second option, that was superior laryngeal nerve divides at C3. But our MCQ is the C6, what happens at the C6 level. So the second option, that superior laryngeal nerve divides, is not correct because superior laryngeal nerve divides at C3 level. Here you can see this is the C3 level, this is hyoid bone, and this is a superior laryngeal nerve. Here it divides at the level of hyoid bone or at the level of C3. So we can say that superior laryngeal nerve doesn't divide at the level of C6 because it divides at the level of C3. Third option we have is that esophagus begins at the level of C6. This is correct option because esophagus begins at the level of C6. Here we can see in the diagram, this is esophagus, this is beginning of esophagus, this is like thyroid, this is trachea, this is esophagus, and this is the beginning of esophagus, and this you can see the level that is C6. So we can say that esophagus begins at the level of C6. The fourth option was the recurrent laryngeal nerve divides into internal and external branches below or at the level of cricoid cartilage, that is at the level of C6. So there is the discrepancy that because recurrent laryngeal nerve divides into internal or external branches either at the level of cricoid cartilage, that is near that is at the level of C6, or below the level of. So when we talk about esophagus or recurrent laryngeal nerve division, there comes a confusion. But as we know that sometimes it divides below or at the level, so we will prefer the our third option, that is C6 level esophagus begins. So we can answer this MCQ that at the level of 6 cervical vertebra, common carotid artery doesn't bifurcate, superior laryngeal nerve doesn't divide, but esophagus begins and recurrent laryngeal nerves divide into internal and external branches, mostly below or at the level. So we will prefer the answer that is esophagus begins at the level of 6 cervical vertebra. Now the second MCQ is the patient has a facial paralysis characterized by minimal weakness of upper facial muscle. Lesion is in the options are supranuclear lesion, nuclear lesion, peripheral nerve lesion, or none of the above. Here we can see the scenario that patient has a facial paralysis, but it is characterized by minimal weakness of upper facial muscle. So lesion can be in one of the following areas, either supranuclear lesion, nuclear lesion, peripheral nerve lesion, or none of the above. We have a diagrammatic representation of this. When there is facial nerve lesion, there is a lesion of facial nerve, the whole of the face, whole side of the face, whole affected side of the face will be paralyzed. Here you can see the division of nerve, facial nerve division. But when there is a supranuclear lesion, here you can see there is supranuclear lesion. It can be there or anywhere above the nuclear region. So when there is supranuclear region, the upper portion of the face is not paralyzed, but the lower portion of the face is paralyzed. So this is the difference between the lesion of facial nerve versus a lesion of the facial nerve that is above supranuclear lesion. Supranuclear lesion. So we can say that if a patient has a facial paralysis characterized by minimal weakness of upper facial muscle, then lesion is most probably in the supranuclear lesion. Going towards our third MCQ, that is muscle which abducts the vocal cord is, options are cricothyroid muscle, lateral cricoarytenoid muscle, intra-arytenoid muscles, or posterior cricoarytenoid muscles. These are the options, and we have to find out which muscle abducts the vocal cord. For this we need to know which muscle do what thing, so that we can easily confirm that which muscle abducts the vocal cord. So the first option is cricothyroid muscle. Cricothyroid muscle is a small bilaterally paired muscle found deep in the anterior compartment of neck, but its main function is to tilt the thyroid forward to help tense the vocal cord, facilitating vocalization and altering tone of voice. So that's why it is also called a singer's muscle. But here, as we see, its function is to tilt the thyroid forward to help tense the vocal cords. That will further facilitate vocalization and altering tone of voice. But its function is not the abduction of vocal cord. So we can say that the first option, that is cricothyroid muscle, is not correct, because the function of cricothyroid muscle is not the abduction of vocal cord, but its function is to tilt the thyroid forward to help tense the vocal cords. The second option we had is lateral cricoarytenoid muscle. The lateral cricoarytenoid muscle is an intrinsic muscle of larynx that narrows the space between the vocal folds, modulating the tone and volume of speech. It is innervated by recurrent laryngeal nerve, but the point we are concerned with is the main function of lateral cricoarytenoid muscle is to aid sound production by adducting the vocal cord. So the function is to adduct the vocal cord, not abduct the vocal cord. So we can see that the second option is also not correct, because it helps in adducting the vocal cord, not abducting the vocal cord. The third option we have is intra-arytenoid muscle. Here you can see the arytenoid muscle. The specific functions of different arytenoid muscles are as follows. The first function is adduction of arytenoid cartilage. The second function is closing the aperture of glottis. The third function is adducting the epiglottic fold. But here we have seen that the function is adduction of the arytenoid cartilage, not abduction of vocal cord. So the third option, that is intra-arytenoid muscle, is also wrong, because it does not abduct the vocal cord. The fourth option we have is posterior cricoarytenoid muscle. The posterior cricoarytenoid muscle is a muscle of the larynx that abducts the vocal cords and opens the rima glottis. Here we see that the posterior cricoarytenoid muscle helps in abducting the vocal cord. And we also need to know that it is the only muscle that can open the vocal cord, and it rotates the arytenoid cartilage later to perform this action. But the main important thing is that it abducts the vocal cord. So the fourth option, that is posterior cricoarytenoid muscle, is correct, because this is the muscle which abducts the vocal cord. Thanks for watching. Don't forget to like, share, subscribe and comment, and if you want us to make video on any topic, you can also comment that.